Let's get started. I'm Ken with Ken's Insurance Agency. We are a full insurance brokerage. We can help you with health insurance, life insurance, supplemental insurance, retirement planning, prepaid legal, identity theft protection and restoration, credit repair, auto, motorcycle, ATV, RV, homeowners, renters, condo, commercial insurance, and even a benefits package, to just name a few of our services. Tonight we're going to be talking about Medicare and our Medicare offerings. So we hope you'll stay tuned and check this out. It'll also be on our social media pages, so please check this out. Look forward to being able to help you with this. So let's get started. So Medicare. Medicare is healthcare for certain disabled people and seniors. Consists of Part A, which is your hospitalization, Part B, which is your medical, Part C, which is Advantage, which generally comes partnered with Part D in it, a supplement, and Part D. Sometimes you'll have mixed into Part C, Medigap policy, and those are a little different. Open enrollment, October 15th through December 7th, is one enrollment period. Another is the 7-month period around your birthday, starts 3 months before your birthday, the month of your 65th birthday, and 3 months after your 65th birthday. The next is you can have special enrollment periods, like if you start receiving Medicaid, if you gain a chronic illness, if you move from one coverage area to another coverage area where your coverage is not offered. These are different kinds of setups that you can have. You can face penalties if you do not sign up for Medicare's Part A, B, and D around your 65th birthday, or if you let your coverage lapse. Medicare Part A covers inpatient hospital care, skilled nursing facility care, long-term care hospitals. Most people don't pay for Medicare Part A. If you pay for Medicare Part A in 2019, you'll pay up to $422 each month. If you paid taxes for less than 30 quarters, the standard Part A premium is $422. If you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium is $232. On top of this, you'll pay $1,340 deductible for each benefit period. Here's how the benefit periods go. You have your deductible, then days 1 through 60 is $0 coinsurance for each benefit period. Days 61 through 90 is $335 coinsurance per day of each benefit period. Days 91 and beyond is part of your lifetime reserve, and that's $670 coinsurance per each day. Once you use up your lifetime reserve, it's gone. Once you get have gone through your lifetime reserve and you go, or you which is 60 days from that 91 day to the end, or after you've used no longer have your lifetime reserves after the 90 days. Whenever you have over that, you pay all cost. Also, if you're released and you go back in after 90 days, you pay your deductible again. It resets every 90 days on the deductible. Part B covers two types of services: medically necessary services, preventative services. Part B covers things like clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, partial hospitalization, and getting a second opinion before surgery. Limited outpatient prescription drugs, and basically you'll have a couple ways to find out what is covered if you're not certain. Medicare coverage is based on three factors: federal and state laws, national coverage decisions made by Medicare about whether something is covered, and local coverage decisions made by companies in each state that process the claims for Medicare. The standard Part B premium is $134, but can be higher based on your income. However, some people who get Social Security benefits will pay less than this amount, $130 on average. Your Part B deductible is $183 per year. After your deductible is met, you typically pay 20% on the Medicare approved amount for most doctor services. Medicare Part C, which is also known as Medicare Advantage, is a plan that will cover your medical and doctors. It is provided by a private insurance company. You must have Part A and B, usually includes Part D. And if you get Part D, you have to get one that comes with your Medicare Advantage plan. It's very affordable priced, usually anywhere from $0 to $99. So very affordably priced. Has deductibles, co-pays, and co-insurances. Usually comes with extras like the ability to have a free gym membership, hearing, vision, and dental. Medicare supplements, a way to pay for your out-of-pocket expenses, must have Medicare Part A and B, cannot have Medicare Part C. Part D is sold separately, is more expensive monthly than Part C, broken into different versions: A, B, C, F, F high deductible, G, M, and N. After this year, you will not be able to get C, F, and F high deductible. Can have a deductible and co-pays and co-insurances. Usually does not have extra services like hearing, vision, dental, and does not come with a free gym membership usually. Prescription drug coverage is your Medicare Part D, which is also known as PDP or prescription drug coverage. Provided by private insurance companies, must have Medicare Part A and B, cannot be part of a Medicare Advantage. It can be part of a Medicare Advantage or sold with a supplement as a separate thing. If you have a Medicare Advantage plan, you must buy it with the Part D that is included in the plan. Each Medicare drug plan has its own list of covered drugs called a formulary. They're broken into tiers that determine what your cost will be. A drug in a lower tier will generally cost you less than a drug in a higher tier. And basically they have guidelines and rules about the formulary, but each formulary has to have one drug for every covered event that you could have. If they're not going to cover a drug, they must provide written notice to you at least 60 days prior to the date the change becomes effective. And they should supply a 60-day supply of the drug under the same plan rules as before the change. What you'll pay whenever you are looking at a Medicare drug plan, you'll pay your premium, your yearly deductible, co-payments and co-insurances, cost in the coverage gap, cost if you get extra help, cost if you pay a late enrollment penalty. Your actual drug costs will vary depending on the drugs you use, the plan you choose, whether you go to a pharmacy in your plan's network or out of your network, whether your drugs you use are on your plan's formulary. Also, whether you get extra help paying for your Medicare Part D cost. So let's see here. Basically, the Medicare Part D is based on income also, and also you can get penalized on it if you do not enroll when you lose credible coverage from work or when you turn 65. Deductibles vary between Medicare drug plans. No Medicare drug plan may have a deductible more than $415 in 2019. A co-payment would be a fixed dollar amount like $10. A co-insurance would be a percentage like 25%. Once you reach the coverage gap, you'll pay no more than 35% of the plan's cost for covered brand name drugs. The coverage gap, you start it at once you reach $3,820 in drug cost. Once you've spent $5,100 out of pocket in 2019, you're out of the coverage gap and in what's known as catastrophic coverage. You can also have supplements for Medicare people like cancer, critical illness, hospital indemnity, Medicare gap. These can be good. They can also hurt you if you're on Medicaid. So we do look at it as a case-by-case basis as to whether you need these. You can also get extra dental coverage and vision coverage, and even in some instances, extra hearing coverage. So these could be some good things for you. And then we want to also show you one of our other supplements that you can get for Medicare that would be of benefit to you.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic, but do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room, but that would cost $750. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board-certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. A prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience of teledoc doctors, 15 years. Average time it takes to get a call back from a teledoc doctor for the quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once.
Now, also, let me inform you that if you just go to Teladoc, you could have an out-of-pocket fee. We have a special relationship with Teladoc through the company we go through that provides this and telecounseling, which you'll see next. And there is no out-of-pocket cost after your monthly premium.
What is that?
A bottle.
A bottle. What's in the bottle?
Nothing.
Nothing's in the bottle. All right.
See?
Exclusive.
Mom, come on.
I'm still working. I just need more help from you.
I'm doing the best I can.
I feel like everyone is leaning on me to do everything, Mom.
You know, it wasn't always easy with you and your dad either. But you're losing out on moments you aren't going to get back. Maybe it's time you talk with someone.
Hi. Thanks for seeing me.
I'm glad you scheduled some time. How can I help? Make some mental notes, and we can talk about it next time.
Thanks, Dr. Brown. Let's meet next week. This castle needs a dragon, huh? Arr!
They're finally asleep. How are you?
I'm good. I think we're gonna be all right.
So that shows you the two. Now, there's other things that's included in it. There's some add-ons that we could go through. You'll get pharmacy discounts. There's a dental discount add-on program. There's even a way to get your prescription drugs to where you know what you're going to pay when you walk into the pharmacy with this. So contact us. Let us know if you're interested. We'll definitely be glad to help you, and would love to help you with this. We are looking for Medicare agents right now. We're also looking for health agents for the under 65, life agents, commercial agents, auto and home agents. If you don't have an insurance license, we can help you get licensed. If you do, basically, we would love to talk to you either way. Also, if you need to sit down and go more in depth on Medicare, you got questions, give us a call. We'll be glad to help you with your Medicare needs and Medicare questions. Look forward to helping you and look forward to talking to you. And you can reach us at 662-912-3914. Again, that number is 662-912-3914. 3914. And you can also go to our website, kensinsuranceagency.net, and talk to us by sending us a message, and we'll reach out to you. Thank you and have a nice day.